All right, everybody, welcome to an introduction to image transformation therapy. This is a total and completely new approach to psychological treatment. It's fundamentally different than anything that has ever been approached before. I have been using it I used it when I was at Camp Pendleton, and I fully developed it so that I actually named it a year ago last July. So it really has been a brief time, but in the 14 months after that I was at Camp Pendleton, I was constantly using this to treat PTSD, as well as, by the way, as feeling state work. And so it's been proven very effective. Now, these are what I do for the for a full 2-day workshop on that, which I have one coming up in Raleigh in January and in Oklahoma City in February, and hopefully be setting up some more. Now, I want you to imagine something. Imagine a treatment that you don't have to experience the feeling. You don't have to feel the pain, don't have to feel the terror, you don't have to feel the guilt, you don't have to feel the shame. As a matter of fact, it would interfere with the release. So all you have to do is notice it from a distance. Imagine a therapy you don't have to install positive cognitions or try to replace negative with positive. Imagine a therapy that doesn't process the trauma but releases it instead and eliminates it from your psychological system. Imagine a therapy that is gentle, effective, and efficient. You can imagine image transformation therapy. It's a whole different form. Now, imagine the concepts are so simple, even a child can understand them. Well, I'm sorry, I didn't get that one. It's not that the concepts are difficult, by the way. It's that you're used to thinking about them in a certain way. In some ways, a child could understand them. They're that simple. But boy, relearning it, it's a total different way of thinking about things. And that is actually the most difficult thing of all. And it's based on a totally different understanding of psychological dynamics called the survival model of psychological dynamics. And what I'm going to introduce is, you might say what I think of as one of the most best ways of illustrating the effectiveness of ImTT is to use it on something that nobody else has been able to do a very good job on, and that's obsessive-compulsive disorder. The standard treatment right now is exposure with the response prevention. The client is exposed to anxiety-producing stimuli, so let's say the pencils are slightly out of order and that really bothers them, and they have to sit there for hours acclimating to that, habituating to it. And then they have to do a lot of homework. So the gold standard for OCD treatment format is twice weekly sessions lasting 90 to 120 minutes. Therapist supervises the sessions. Treatments involve actual and imaginal exposure practice, homework, assigned self-exposure practice, outcome. There is significant improvement, but full remission is not the standard. There's a 25 to 35% dropout rate, 30% dropout rate prematurely. And a lot of people won't even attempt it. It's just like, I'm not about to do that, okay? And when they call significant improvement, mainly it's behavioral. They're able to do, but the obsessive thoughts, I've been told by the people who have done it, it doesn't work really well with that. Imaginal exposure does not work nearly as well. And so with OCD, one of the feelings that people have is that something bad is going to happen, right? They know that doom is going to happen some way. And so what they've got, basically they're doing, they're having in exposure treatment, they're having people be exposed to it and no doom occurs, right? But they're very much working on behavioral management there. And with ImTT treatment of OCD, there is no behavioral management at all. None. We work on the psychological dynamics that underpin the OCD. And sometimes, by the way, it's so effective and so gentle that people don't even know their behavior's changed until we really call their attention to it. They just stop doing stuff. You know, when you don't have to, when you stop feeling that doom is going to happen, you don't even know, you just stop doing whatever that behavior was that was trying to keep you safe. What ImTT does is it releases the terror, just like we were doing with the pain terror release protocol. The way we release the pain, you release the terror. And it deconstructs the terrifying images. And once you do that, the OCD behavior just go away. The whole purpose of the staying safe behavior, let's suppose that they are washing their hands because they feel they're being poisoned. They feel like, you know, that they're going to get poisoned if they don't. And if they stop feeling like they're being poisoned or are about to be poisoned, then they stop washing their hands. It's that simple. The problem is that trying to treat it behaviorally has been, you know, it's very difficult. What you're asking people to do is they're terrified. You're asking terrified people to stop doing a behavior that they feel keeps them safe. Wow, that's tough. Talking people out of their terror, not really useful, not really effective. Now, what I'm showing you here is 5 people that I've actually done work with. And these are 5 different participants. The numbers here indicate the number of sessions. And the instrument I used that is being used here is the Obsessive-Compulsive Inventory Revised, which you can just download from the internet. And it's a standard instrument for measuring OCD. And it's a 18 question instrument that measures each behavior on a 0 to 4 scale. And so it's not about adding it all up, even though we do that. It's about the important thing about that instrument I like is that it shows you the intensity of each individual behavior. But this is their overall scores. So participant 1, and I'm going to go, and then participant 1, because it was a short, it was only 3 sessions. I'm going to go through that in detail just because it's easier. It was my very first one. It was my second one. The very first person I worked on, I was just trying to find out whether it really worked. And it worked in 2 sessions. And I'm going, man, I should have done some instruments on that one. I should have measured something here. And so from then on, I started doing that. As a matter of fact, I use the instrument with every session. And whether I'm doing research or I'm doing or just regular treatment, I do it every session. I'll explain more later why. So with participant number 1, it took 3 sessions to go from about 36 to about 4, something like that. For participant number 2, it went from 52 or 3 down to about 12 or 13. And by the way, all these numbers indicate that he no longer has OCD. You could have a very, very mild form of, when you get down to one, like some of these, when you have 18 behaviors, somebody might have a little problems with feeling that they have intrusive thoughts or negative thoughts, but they're so mild that no longer they're really bothering them. They're just kind of there a little bit in the background. But the score, they consider the cutoff score normally for OCD with this instrument is 25, which would be around here. I don't really like that too much because I've seen people with one behavior that took up hours every day. You know, so it's not really a good indicator unless, you know, unless there's multiple behaviors. And with all these people, there were multiple behaviors. And, so the second person, in 4 sessions, we went from here to here. For participant 3, it was 3 sessions to go from, 7 sessions to go from here to here. 11 sessions for this guy, and 5 sessions from this guy. And you can see how effective it is. And, you know, people didn't have trouble coming in. They loved it. They came in. They always left feeling better. And a lot of times you have, with OCD, you have multiple behaviors. So sometimes the reason why some of these people take a lot of times is because it would be 1 session, 1 behavior. is what you might have to work on, because there's different images underlying each one of them. And for other people, as I'll show you with participant number 1, he did have a lot of behaviors, but when I processed the very first one, almost all the behaviors went away. But that turned out to be, that was kind of unusual. Turned out that pretty much it's one behavior, one session to process. And that's kind of what happened with the person who took 11 sessions. All right, now I'm going to talk about, this is the first guy who it took 3 sessions. It really only took 2, but I'll show you why I say 3 anyway. So his behaviors were clearing the house. He would have to go through the house and making sure it was safe every time. He had to clean up his room every night before going to sleep. Everything had to be perfect. He was a hoarder. He had a full garage full of 7 huge bins of motorcycle parts, all kinds of things that were around. He had bins of papers, a lot of old toys that were both in the garage and in the backyard, and he just had to keep it all up. And he said it was very well organized, but it was neat, but it was just it was all there. He always kept his blinds closed, and his clothes always had to be ready for the next day. This is the OCI form, and actually I was wrong. It's 20 questions here. And these are the questions, and that if it's yes or no on this, no, I take this back. This is the Florida Obsessive-Compulsive Inventory. I always use that as well. And the reason for that is I like this part of it. This part of it gave me the overall severity of all of them combined. See, on this one, it's yes or no. Each behavior is yes or no. And this gives you the overall severity. So, for example, how much time does he give to these thoughts or behaviors? And he's saying it's 2 to 3 hours per day. That's how much time it's taking to do that. And his score here is 12. The OCI, this is OCI form, it is 18, okay? And 28 is cut off. Okay, so he scored 36 before the first session, at the beginning of the first session. And what we did was, since we processed the image of him clearing the house because someone was going to hurt his family. And the feeling was something bad was going to happen. And the results for it were he comes in the next time, the next session, 2 weeks later, and his behaviors have dropped from, I didn't write that down, did I? Oh, there. His behaviors have dropped down from like 9 to 2 at that point. And severity has decreased from 12 to 4. The OCI form has decreased from 36 to 13. And this time what we processed was his hoarding. He said that was the next thing that was bothering him the most. And so the behavior is not being able to throw things away, and the feeling something was bad was going to happen. Now, and the basic image was that what we got to was this. I said, well, if you throw something away, what's going to happen? He says, I'm going to need it. Well, if you need it and you don't have it, what's going to happen? I'm probably going to get fired. If you get fired, what's going to happen? I'm probably going to lose my house. If you lose your house, what's going to happen? I'm going to end up homeless. I'm going to end up homeless under a bridge and smelly and raggedy. And that was the image. And we processed that image in a Terra. And when he comes in 2 weeks later, he's cleaned out 80% of his house. And I did not give him one suggestion, by the way, about his behavior. I did not suggest he clean his house. I give no suggestions about changing behavior whatsoever. They just change their behavior when the Terra goes away. And he cleaned out his garage, including 6 to 7 large bins of motorcycle parts, the toys in the backyard, 2 large boxes of papers, a non-working AC unit that had been in his garage for 3 years. Now, what was interesting about this part is that I saw after I only saw him for 3 times, but I ran into him about a month later to find out how he's doing, and he said, you know, everything is good, but I'm about to move, and there's still a little bit left in my house that I just haven't gotten around to it. That'll really tell me. And then I saw him about 6 weeks after he moved, and he said, you know, my house is pretty empty, and I love it. He had no problems with it. Now, there was a little complication, though, on this second session. And that was when he was cleaning out his garage. There were so many spiders there. And he took some pictures of the spiders, and he told them to a friend. He says, "Ooh, that's a black widow. Another one's a brown recluse." If you're familiar with those, you know how bad they are. He's freaking out now. Now he's got a phobia. All right? He's not OCD anymore. Now he's got a phobia. Now he can't go to sleep because he's imagining spiders coming down from the ceiling and jumping on him. Okay? And so that's what we focused on this time. And, but anyway, now that was what the 5 was. The severity went from 4 to 5. And what was the 5 was about was now he was scared of spiders. All right. All right. And that's what the OCI was really about. We focused on his fear of being bit by a spider, image of being bit by a spider, cleared the terror, cleared the image. And that was it. And he comes in the next time and he still has 2 behaviors that are only now down to severity of 3. You notice that it's less than an hour now, where he was up in here, 1 to 3 hours. And that's what we did in 3 sessions. Yes?
Is there a likelihood of them developing like a new ritual even after the one?
No, because we cleared the problem.
This fellow developed a phobia of the spiders. That just
It only happened because the spiders were real.
Yeah.
Okay.
They really were brown recluse.
Huh?
They really were like brown.
Oh yeah,
Okay.
he had been in hoarding in his garage. He had been there so long that spiders had built up. And that's why I said he took pictures of them, showed a friend, and they were really there. This was not something popping up just from the other. It was like, oh wow, he really did have a lot of them. And I don't know about you, but I've seen some brown recluse damage from people. It's like, it's pretty terrifying. It really is. Okay. So I'm going to talk a little bit about the clinical experience leading up to the development of ImTT. And I kind of talked about that to begin with, the guy who was suicidal. And that I thought about if we just release the emotional pain, you'd stop being suicidal. And then I developed that on the spot, really, the breathing visualization technique. And it kind of grew from there. And the next person, the conclusion from that is emotional pain can be released from the body. And I had also a 10-year-old child who had multiple tantrums. And she'd been having it for about 6 months because of a very bad emotional interaction with her father. She was living with her grandmother at the time. So at the end of it, at the end of the first session, I took her through this, and her grandmother was with her, and her grandmother had really been suffering from, and was a little daughter, for all the multiple tantrums. And she comes back in the next week, and she'd been down from multiple tantrums to 2 tantrums a day. And the little girl was actually using it herself. She liked it so much. And the little girl felt much, much better because she felt much more in control of her own life. So I realized that even children could do it. And as I may have mentioned to some people, there's actually a child protocol of ImTT, that was developed by Dana Tennyson in Minneapolis. She based on this, and it really has to do with working with the developmental level of people, so they can do that. The youngest I've worked with was 6, and she was doing an OCD for a child who was 7, and it worked very effectively. Now, the next thing is something that was another major really leap, is that guilt and shame. I was working with a woman whose fiance had killed himself. And everybody said, it's not your fault, et cetera, but she had found him hanging in the garage. And for the last year and a half, not only was she in a lot of pain, she felt tremendous guilt that she didn't somehow, woulda, coulda, shoulda, that kind of thing. And when she's sitting there, I just kind of had the insight. I thought, well, I kind of think that if you clear the pain, you clear the guilt. And that's exactly what happened. It turns out that underlying guilt is emotional pain. And you clear the emotional pain and the guilt goes away. Just goes away. So I didn't ask her to feel the guilt. That's the nice thing. All I asked her was, yep, is it painful? Yep, she said. And just like we did the PTRP, it cleared the guilt as well as the pain. Just goes away. Okay? And so that was actually the discovery that emotional pain was that guilt was energized by emotional pain. So underlying guilt is in pain. Now, the discovery of Tara, the use of Tara. This was a case of hypochondriasis. This was a 90-year-old gentleman who was almost demanding of his wife to take him into the ER 2 to 3 times a week. Every time he had a little something, it was like, oh my God, I'm dying, and he had to go into the ER. And, you know, think about how long it takes at the ER, right? So the wife finally got fed up and said, you're going to therapy. So he comes in, you'd heard about me, and I traced the terror of dying down to when he had a heart attack when he was in his 50s. And now I'm thinking about this. This is a 90-year-old, pretty frail man. And I'm thinking, if I clear it with EMDR, he's probably going to die on me. And I was really actually serious about that. I mean, you know, when I've cleared Tara with EMDR, they've got to feel it. And it's intense, all right? And if you don't get into it, it doesn't happen. And so I thought, okay, can you feel the pain underneath the Tara? Trying to get out. He said, no. I went, oh, okay, that ain't going to work. So I decided just go for the Tara, right? So I said, what color's the Tara? We did it. It took about 7 minutes. So I hadn't developed the full protocol at the time. And he said, I feel a lot better, thank you. I'm kind of going, did it work? I don't really know. So he comes back in 2 weeks later and asks his wife, how's it going? She said, it's great. She said, he's had a few things, he needed to see the doctor, but he didn't need to go to the ER. Okay? So that told me that Tara could also be released from the body. And that's a pretty big deal. Released without ever having to feel it. And now I get to shame. And the odd thing is, I actually don't remember how I figured this one out. I probably just started doing it one day without even thinking about it. I have no idea. I really don't remember this. But what I discovered was shame says I am bad, right? Well, if you're bad, I want you to think in terms of tribes. If you're bad, you don't belong in the tribe. You didn't just do something wrong, you're bad. And if you're bad, you're going to be excommunicated, shunned, exiled, whatever it is, and if that happens, you're probably going to die. Shame is a way of signaling to the group, yes, I know I'm bad, but don't kick me out and don't kill me. Now, if you think I'm exaggerating, think of honor killings in the Middle East. They really kill women because they have shamed the family, right? So the idea that people could die because they are now bad is not at all far-fetched. It is absolutely what has happened. When somebody is bad, they may be exiled or killed. Shame, you think about a dog when they're experiencing shame. Head is down, you know, they're no longer the alpha dog, right? And what shame says, I will accept my low status in the group, but don't kill me. Don't kick me out. So shame is a way in which we signal to the group that, yes, we know we're bad, and I'll accept that low status in the group. Now, so what that means is you're terrified. You're terrified of dying, right? Because if you don't get the group's approval to stay or not kill you, you're dead.
I mean,
Huh?
I'm just curious. Why would abandoned versus death?
Well, if you're abandoned, if a baby's abandoned, they die. Abandonment is death to a baby, okay? And exile is death to an adult. Exactly. And what happens, of course, is you can have abandonment issues as an adult because it triggers your old stuff. I mean, it's true in our society, somebody, one group doesn't like you, you just go someplace else, okay? But that doesn't mean it feels that way. Now, if abandonment issues occur in your childhood, now you can have abandonment issues without shame. But every time you have shame, you have fear of death. You have terror of death. That means that terror underlies shame. So, if you process the terror underlying shame, the shame goes away.
Say it again.
If you process the terror underlying shame, the shame goes away. Because the only reason a person experiences shame is because they're terrified.
But if you try to... Does the person have to know that they have terror underneath shame?
You have to identify it. So, for example, I was talking about the woman who'd been sexually assaulted. And the first thing I did, her legs were shaking. And so the first thing I did was release just the terror of her sitting there. Then I said, it sounds like you have a lot of shame about that. And she said, yes. And so I said, can you feel how terrifying it is? And she said, yes. So I had to connect the shame to the underlying terror. And then I said, what is the color of the pain? What is the color of the terror? Because it turns out that shame and terror are primary reactions to negative events. And that when you clear the primary reactions, you clear all the dynamics that are resulting from those primary reactions. At this point, I was still doing EMDR, and I found out it just made EMDR processing so much easier, is what you'll find. With your EMDR, doing the PTRP first makes it so much easier to do your standard protocol. So the major new hypothesis is pain and terror are primary reactions to negative events. And this was actually a really big deal. So the four hypotheses are pain and terror, primary reactions to negative events. The pain and terror, the PT I call it, continue to energize the memories. Releasing the PT de-energizes the memories, and releasing the PT de-energizes negative cognitions and feelings. And that's important because by de-energizing that, all of a sudden they become a shadow of themselves. All of a sudden they're no longer powerful. Okay.
Are you saying that when they have the pain and terror, they're a shadow of themselves?
I'm saying the image is a shadow of themselves. The shadow of itself.
Representation, not the person.
Now, the person doesn't become a shadow. No. A shade. Okay, a ghost of themselves. No, the image does, though. So you can have a really traumatic image that is very painful or very terrifying, and once you remove the terror, all of a sudden it just kind of fades away. Okay? It's still there, and that's why we have to do the next. So what happened is, a lot of times, once you release the PT, the pain terror, from an image, people would just go, that was so ridiculous what I was thinking about. Yeah, what's the big deal? Unfortunately, it didn't always work. And this was the case of the stupids. And so I had a woman who was really, really intelligent, who believed she was stupid. Couldn't shake it. Didn't make, the professor, all this stuff, didn't make any difference. Her belief that she was stupid was a fact of life. And so what I did, so I said, well, is it painful or terrifying? She said, it's painful. We released the pain. And I said, well, how is it? She said, well, it's not painful anymore, but I'm still stupid. And I went, oh, something more is here. And what the something more was was the image. We released, while we de-energized the image, and released that, it was still there. The image was still there. She still believed that she was stupid. It just didn't have as much power over her. It was no longer painful. And that led to the image deconstruction protocol. And with the image so from that point, what we did was deconstruct the image that she was stupid. So she asked her what the image was. She gave me a certain image of that she was stupid. And once we deconstructed it, she realized how silly the whole thing was. So first we released the pain, then we deconstructed the image. And the image deconstruction protocol is in your manual. To sum up, pain and terror energize negative images. Feelings and cognitions are created from the images. Removing the pain or terror from an image allows an easier and gentle method of processing, and negative images can be deconstructed after the PT is released. And so it's actually a whole new also a whole new cognitive therapy, you might say. Somebody comes in and they, I'm a worthless person, and you form an image of that, clear the pain or terror underneath it, and then you clear the image. And they just stop thinking that way. Because what people think of as facts, like being stupid, aren't facts, they're images. That's all they are. They're just images. And you clear them with this very gentle method, and it just goes away.
Can you give an example of what an image might look like?
An image could be a memory. I use the word image more than I use the word memory. If you're dealing with a traumatic memory, then that is kind of the image. But the truth of the matter is, we have a lot of, like, when I was dealing with the OCD guy with hoarding, and the image was, I'm going to be homeless under a bridge where I get smelly. Never happened to him, all right? That was his terror. He was terrified of that happening to him. Maybe one day when he was like 10 years old, he saw somebody, that, and he just, wow, if that's what's going to happen to me if I get rid of things. That one actually was her father calling her stupid. Okay? But sometimes the images are have a lot to do with memory, and some of them are just made up, especially when it comes to phobias. Sometimes they can be just totally made up things. And also in even some traumas, if you really ask them to enhance the trauma and bring all the psychological elements in it, turns out there's a lot more than just the memory. And we know that memory is unstable. People don't remember what's true. It doesn't matter what's true. What matters is in their mind. That's what's causing the dysfunction. So what we want to know is not what happened, but what are they thinking? What's actually in their mind? So you may have had a traumatic event, and then there's 3 other types of images that are part of it that they projected into it. And you want to clear the whole thing. So if you make up an image of the whole thing and then clear it, it works faster. You don't leave psychological elements behind. So what's important, and this really kind of frees you up when you realize that you're not trying to clear the truth, what really happened. What you're trying to do is find out what's in their mind. That's what's in their mind is what's causing the dysfunction. Yes?
So a lot of times the negative cognition could be what needed to clear that may be in their mind. And sometimes with a phobia, it could be something pretty catastrophic, fantastic. That could be in their mind.
Well, with the very first guy I did OCD with, one of his things he had to do was he had always had the volume on his radio on 2468, an even number. And so he was constantly, while he was driving, it was dangerous, risky what he was doing. He'd always have to be looking to make sure that his dial was still on an even number. And I asked him, well, what's going to happen if you don't do it? Something bad is really going to happen. I said, well, make it up. What's going to happen? He said, well, I think the sun is going to explode and melt everything over the earth. And that's the image we cleared. Now, ultimately, OCD is trauma work, by the way. It turns out that everybody I've treated with OCD has trauma of one kind or another. It's just that you have to get to it in a different way. But it turned out that everybody was terrified for one reason or another. One person, there wasn't obvious trauma in the way that we really think about it. It wasn't physical abuse or any kind of sexual abuse or anything like that. He was raised in more of a fundamentalist religion, and he believed in the devil, and he believed the devil was going to get him for any little imagined slight, anything he did. And he was actually one of the most difficult people I've ever had to work with. You know, when people are traumatized and somebody's beating them up or threatening to beat them up or whatever it is, hey, that's easy to process. But when somebody still believes in the devil, when somebody believes that this is what's going to happen, it's part of the religious imagery that they have, that is much more challenging. So I actually had to read parts of the Bible in order to say, hey, look, you know, that's not there. What you're saying isn't there. They've just made it up. And that's what a lot of it was. It turns with this person, yeah. Okay.
You point out it's not there, it's just not in that guy.
No, I didn't have that problem. Okay.
But they use the devil to induce fear and terror.
Absolutely. And he was one of the more difficult ones, and it took a long time. I actually spent a lot of sessions doing basically cognitive work and going, well, is that really in the Bible? Let's look at this. And challenging, and that had to do a lot of challenging that way, actually. And then when we get to a certain point, I mean, he had, by the time we finished, partly, we're still not finished with all of it, but his belief in the devil and terror of going to hell was way diminished. It wasn't totally gone, because he'd been inculcated with that with a really intense, but it was like, you know, if he masturbated, he was going to hell. So that was pretty intense. But everybody else who's just been merely traumatized were easier to work with. Okay. So the fundamental building blocks of psychological dynamics are the images of the mind. And they're energized, and that was born image transformation therapy. And image dynamic therapy, how images are created, maintained, and transformed in the effect of images on psychological patterns. The goal of image transformation therapy is to eliminate the destructive images by doing the PTRP to release the PT and revolving that, and the IDP, which deconstructs the image. Now, one of the things we don't do, now tools for processing are the pain terror release protocol, the image deconstruction protocol, and what's called the changing patterns protocol, which I'm not going to go through right now. It's of lesser importance. And now, these are the processing tools, like you use BLS. But, you know, the processing tool doesn't give you the target. It just tells you what you're going to use, what the tools you're going to use to process the target. The survival model of psychological dynamics is the one that gives you the target. It helps specify what you're going to do. And we've already done that. That's a big one, of course. This is actually the beginning of my workshop here. But so anyway, with with image transformation therapy, the survival model of psychological dynamics is what gives you the target. And what I mean by the target is if you're dealing with guilt and shame are feelings with a purpose. The purpose is survival. Survival through relationships. Pain, just plain flat, we feel pain and terror in order to survive. So if something is hurting us, we have to stop it from hurting us or we will probably die. If something is trying to kill us, we need to either fight or flee. Okay? So those are basic personal, immediate survival needs. But think about it in tribal terms, relationships are crucial for survival. Okay? If you do something wrong and you feel guilt and you apologize and you buy flowers or do whatever it is, you're repairing the relationship. If you are bad, if you do something outside the group norms and you are bad, then by signaling shame, you're saying, don't kill me. So what happens is these are survival emotions, survival feelings. They're there for us to survive. Tribes who did not have these emotions died out because they did not repair their relationships. Okay? So we're the descendants of those who had guilt and shame to repair relationships. The other ones died off. They're not here anymore. And so what that means is that underlying guilt is pain, underlying shame is terror. And so when you clear the terror, the underlying shame, and the guilt and the pain underlying guilt, those emotions go away. They're no longer useful.
Could you repeat that last?
Sure. All negative emotions are secondary results of primary reactions. Your primary reactions are pain or terror. So in order to survive, if we do something wrong, we experience guilt. We experience guilt because we experience the pain of the relationship. We've done something wrong. And the guilt says, okay, I feel guilty, I need to do something to repair the relationship. And if you clear that pain, the only reason why you feel guilt is because you feel the pain in relationship to that person. Okay? You clear the pain, there's no reason for the mind does not create guilt. Now, think about this in terms of, we're talking about shame now, so the woman who was raped. Now, if a person is raped in our society, the group norms say you're bad, right? The group norms say you're a very bad person and don't belong. Because shame is always cultural. These are always, both guilt and shame are all cultural. There's no such thing as something that always creates guilt or something that always creates shame. It's always cultural. Shame is always about group norms. When you violate the group norms, you're going to experience shame so they won't kill you. That's the purpose of it. Okay? What that means is if you clear the terror underlying the shame, you don't feel the shame anymore. Because the whole purpose of the shame is not to die. If you don't think you're going to die, you won't feel shame. Okay? It's a total rework of, it really turns everything on its head. I get, So, for example, the woman who who had been sexually assaulted, by processing the terror underlying her shame, the shame just went away. We didn't even, all I said was, probably experiencing a lot of shame about that. She said, yes. I said, is it painful and terrifying? She said it was terrifying. What color is the terror? We cleared the terror, the shame went away. It's that simple. Yes?
And if they feel both guilt and shame, which one do you do first?
Do both. Okay? I mean, you just do one at a time. You'd have to, one time you'd clear the pain underlying the guilt, and the next time you'd clear the terror underlying the shame. And you have, and somebody's, and many times I have the question of, well, since you're using basically the same protocol to deal with pain and terror, why do you have to identify them? Well, it's kind of like I'm using the telephone, but if I'm off one number, I'm not going to get the right person. You really do have to contact what's underneath that feeling. Even though both of them, you're saying, what color is it? It doesn't make any difference. You have to identify the underlying shame or terror. Underlying pain or terror of what's actually going on. And you don't say, what color is the guilt? Or what color is the shame? You do not clear them directly, ever. Because it just won't work. You may get some relaxation, maybe, and some stuff, but until you clear the terror, the shame is going to be there, because that's what creates the shame. And the pain creates the guilt. Yes? Say it again.
Could you give examples of what is queer cultural image?
Of a cultural image? I asked myself when I was doing this, what does it mean to be a man? What is my image? And what popped up is the Marlboro Man. I said, and I went, wow, that's weird. That's from my childhood. And I don't even smoke. And then I asked myself, well, what does it mean to be cool? And I said, and what popped up is James Dean leaning against the wall with a cigarette dangling from his lips. And I don't smoke. So, what's interesting, now, why is that important? Because if that's what it means to be a man and that's what it means to be cool, well, guess what? I'm not a man and I'm not cool. And even though I don't agree with those images, even though I've left them long behind, they're still in my head or I wouldn't have thought of it. And that means it's what I call the museum of images in our mind, is all those images that we have rejected, guess what? They're still there. Until you deconstruct an image, it is still there. It's still in your mind. You may not be giving as much energy as you used to, but it's still there. Yes?
I'm curious about when you deconstruct, can people do that every day? For instance, if you're working with people, does it work all the time over and over?
Does it work? Yeah. What do you mean?
When you say the tiny little particles and through that.
Well, when you're dealing with, it's a difference between, when you're dealing with something that's very formative in your life. Let's suppose there was some kind of, like, one woman who was 16 when she was raped. And we were working, she was 23 when we were working. And after we cleared it, you know, she started thinking about her life. She started, you know, she became promiscuous after that. And then what she said was, you know, probably wouldn't have married my current husband. You know, there's a whole kind of stuff. And so there can be very profound changes that occur afterwards. And the more formative something is, more formative means that there are a lot of psychological patterns. You've done a lot of things as a result of it. And what can happen is the person can feel very disoriented for a little while, for a few days. And then what happens, this is one of the differences. You never install anything positive. We do not install positive cognitions. We do not install positive images. What happens is they emerge. And what we're really looking for are not images, but action. You know what it's like? You've heard of being in the sports zone, where, you know, when you're in the zone of doing something and you're just in the flow, right? That is the goal of ImTT treatment, to be in the flow. It's not about be self-conscious and have images like I can do this. One of the interesting things, for example, I was working with a woman who had problems speaking in front of classes and stuff like that. And we processed her phobia of that. And next time she had something to do with class, she just was the first one up and said, yeah, I felt like doing it. I just did it. She didn't feel confident. She didn't feel strong. She just did it. The only reason you have to feel strong is because you feel weak. The only reason you have to feel special is because you feel worthless. When these images are gone, you just do what you want to do. You just act appropriately because you're more tuned into yourself as well as the world in an appropriate way. You're no longer acting from pain and terror. And you just do things. It's not about feeling positive. You don't have to feel strong. You just do it. There's no reason not to. Why not? It's a big deal. Okay? Yes? If I were dealing with abuse, it's not that. It's just like when you clear it, it's just gone. Doesn't mean anything anymore. Huh? Now, at the end of it, you know, the underlying assumption here is that there is an underlying deeper self that starts to emerge. And so she doesn't have to feel worthwhile or anything. The problems just go away and she's just herself. Everything else is irrelevant. Does that make sense?
I guess if that person had a concrete memory and you're looking at a fear underneath that memory, then the rest of the secret stuff, right? Person doesn't have a concrete memory, they just feel bad.
If you don't have a concrete memory, you make it up. Make up an image. So when you're dealing with something that's either pre-verbal or the person just has a feeling, like suppose they have a feeling of abandonment, but they can't seem to put it anywhere. Make it up. What does it look like? Oh, I'm in the middle of the desert and I'm screaming and no one's listening to me. That's how they feel. All right. So is it painful or terrifying? Terrifying. Clear the terror, deconstruct the image. Boom. It's amazingly how fast this works. So I had a guy come in who had problems. He had problems with anger. His wife would ask him to do something. He was fine. He'd start to do it. And then she'd kind of interfere a little bit or something and ask him to do something else. And then he'd be able to kind of like, okay. And then she asked him to do something else again, and now he's starting to really flip out, okay? And what's interesting is then we followed it out. I said, well, if you don't get that first thing done, what's going to happen? He said, well, I'm not going to be a good provider. If I'm not, I'm not going to be a good provider, then she's going to leave me. And so if she leaves me, it's going to be really painful. So that was where it went to. Meanwhile, of course, he was angry at his wife for interfering with him being a good provider. And so we cleared that image, the pain of it, and then deconstructed the image. And he comes in the next week and he goes, and I said, well, how'd it go? He said, I don't really get it. It doesn't make any sense to me. I said, well, have you been angry? He says, not really. I said, well, have you? He said, well, I don't know if there's been any reasons for me to be angry. And then he thought back and says, yeah, I guess there were. The woman, as a matter of fact, whose fiance died and cleared the guilt, about 3 or 4 months afterwards, when we were still working on other issues, I asked her if I could use her story in a workshop. And she looked at me and goes, what story? I said, your fiance. She went, oh, yeah, that. Oh, yeah. It was so gone, it no longer had any impact on me.